Hello, I am Sangeeta from Department of Microbiology, SRM Dental College, Ramapuram, and here I am going to present a topic on air surveillance. So, air surveillance in hospitals, particularly in OT, the quality of air should be calculated. So, it's important to know the quality of air in operation theaters, bone marrow transplant unit, and because it will decrease the surgical site infections to for a sterile field for safe surgery, and also it will reduce hospital acquired infections and also occupational hazards. So for next, standard guidelines for air sampling. So till now there is no standard guidelines mentioning the permissible contamination of air, and the hospital associated infections are not related with the level of general contamination of air. Even though CDC has given certain recommendations, that is when and all we have to do quality control checking, that is during an outbreak, for research purposes, during a construction, or after fogging, or short term evaluation of change in infection of control practice. These are the factors in which we can do our quality control, and based upon the planning, we can divide the hospitals into the four zones, that is protective zone, clean zone, sterile zone, and disposal zone. Then when we check the quality of the air in a room, these are the factors that will depend upon the survival of microorganism, that is suspending media, temperature, oxygen sensitivity, relative humidity, exposure to UV, and the air handling system, HEPA filters, which will perform air handling. So air change or ventilation in a room can reduce the contamination. So if you are in an hour, if you are changing the air, 60 percentage can be reduced. If we in an hour two ventilation or air change is done, means 86 percentage can be reduced, and 10 per hour you can reduce the infection to 99 percentage. Then these are the quality testing methods. First one is sedimentation, then centrifugation, then filtration, then impaction on solid surfaces, then impingement in liquids, electrostatic precipitation, and thermal precipitation. So these are the air quality methods through which we can do the air measurements or the quality of the air. So first one is sedimentation. This is a conventional method in which the blood agar plate or McConkey agar plate is kept in a room 1 meter away and 1 meter above from the in the OT, and multiple samples are collected, and these samples are processed for incubated to 24 hours for colony count, and the CFU is determined. Then next one is centrifugation, in which the aerosols are subjected to centrifugal force, and these particles are impacted on a solid surface. So but there is limitation for spores and organisms that resist drying. The next one is filtration. Air is drawn through a filter unit and the particles are trapped, and these organisms from this membrane it can be taken, that is the membrane can be paper, cellulose, glass wool, or gelatin, or membrane filters, and in which we can transfer into a agar surface. The next one is impaction on solid surfaces. So it can be done, air is drawn into a sampler and these particles will be deposited on the dry surfaces like a slit sampler. Solid impactor units are mostly slit samplers. Then impingement in liquids, in which a liquid impinger with a liquid media will be there, and an inlet pipe and an outlet tube will be provided. So air is allowed to pass through the inlet tube, and the organism will settle down in the medium, and filtered after the air is passed through the outlet tube. Then next one is Electrostatic precipitation. In electrostatic precipitation, air is drawn over an electrostatically charged surface and particles become charged. This is done by an electrostatic precipitator. And this working principle is worked by forcing the air to move in between two electrodes. So the first electrode is very high and negative voltage. Next one is thermal precipitation, in which air is drawn over a thermal gradient and particles are repelled from hot surfaces and settle onto a cooler area. Then processing of first one, that is sedimentation method. The plates were placed at four chosen places in the operation theater at about 1 meter above the ground and exposed to 30 minutes to 1 hour. After this exposure, the plates were covered with the lids and taken to laboratory in sealed plastic bag and incubated at 37 degrees Celsius for 24 hours. And the result and the interpretation is that cloud plates should be incubated under optimum condition for 24 hours. Aerobic cultures of non-selective medium should not exceed 35 colony forming unit of bacteria and fungi per cubic meter for conventional theater and one colony forming unit for ultra clean theater. Then slit sampler, one of the most used sampler because of recent advances in surgical procedure and bacterial settle plate method is used. Next one is sieve impactor, uses stages with calibrated holes of different diameters. Sieve impactors, different gradient hole size can be used, and in both these sampling equipment will determine the volume of air sample. The sampling volume needs to be more than 25 cubic meter and optimally around 1 cubic meter. Once sampling is completed, remove the test strip, agar plate aseptically and label it clearly. The next one is, this is a liquid impincher. You can see the inlet, outlet tube, and the collection vessel and the tangent nozzles. Then the conclusion is that number of studies carried out in operation theater determine the relation between total bacterial air count in OT and risk of infection. It is observed that count in range of 700 to 1800 cubic meter were related to significant risk of infection. So this is a picture representing modular OT. You can see the HEPA filters for free circulation of air, effective lighting, anti-static flooring, laminar sealing with air seal. Thank you. Ammo, I ammo. Ammo.